Welcome to Learn and Smile, the place where you take charge of your health and embrace more happiness in life, with experts bringing you the best and the most accurate knowledge about health and wellness. Learn and Smile is an IOH initiative to empower people and societies with knowledge that changes lives and lifestyles. Lifestyles that make you smile and connect to your core being. Webinars and knowledge hack videos are the key to this process of knowledge sharing. It gives us immense joy to learn together with you. So enjoy learning and keep smiling.
Second speaker is Dr. Suman Lal. Dr. Suman Lal is the CEO of DeckTherapeutis Incorporated, a US-based spin-off from Institute of Human Nutrition, Columbia University of New York. DeckTherapeutis does some pioneering work in omega-3 therapeutics that holds the potential to revolutionize treatment options for stroke patients. Dr. Suman holds from National University of Singapore and is an MBA from the highly prestigious MIT. He is passionate about building products and companies. Today, he will share his thoughts on diet and cancer prevention. Dr. Suman, we are delighted to have you as a speaker today. On behalf of everyone, I welcome you.
Thank you very much. Can you all hear me well?
Yes.
Okay, great. Let me share my screen here. Can you see my slides?
Yes.
Okay, great. So thank you everybody, and good evening to all. It's a great opportunity to share some thoughts here on the topic of breast cancer prevention. I want to express my thanks to the organizers, Dr. Regina and Dr. Rakesh and the Invest on Health team on organizing these talks on a regular basis on a very important topic of lifestyle, medicine, and health and wellness. Obviously, it extends to diseases beyond breast cancer. Many of the topics discussed here, which were covered by Dr. Rakesh earlier on, and in the subsequent sessions, will be applicable to a variety of other diseases that are prevalent. That includes, heart disease, other types of breast cancers, a lot of other health issues. So many of these messages are applicable beyond the topic of breast cancer itself. But today we will focus on breast cancer prevention. So I want to have some disclaimer that this talk is meant to be educational. Again, I'm in the US. We are very careful about the legal implications of all sorts of advice given in this context. So I want to mention and highlight here that please consult your physician or your dietitian or nutritionist for any specific medical advice pertaining to you. And over there, you have a great team with Invest on Health who can guide you on the specific matters. So this is, I wanted to just mention, this is a close relative of mine. She was diagnosed with breast cancer a while ago and was recently discharged from one of the major hospitals in Kerala and left for palliative care at home. This was just a couple of weeks ago. I only wanted to show her picture here to communicate that these are all very personal, very real, and happening on a daily basis. And we all may have people that we know who are affected by this disease. So as Dr. Rakesh mentioned, there are many preventable causes, and we should focus on those and do our part in reducing this great, it's also another sort of an epidemic that is, if not a pandemic, that is in our midst. So on the topic of breast cancer itself, I wanted to just highlight some of the established causes that we are aware of. Rakesh covered this earlier on: early menarche before the age of 12, late natural menopause, not bearing children, having a first pregnancy before after the age of 30. They're all they all increase your risk for breast cancer. Radiation, particularly in early age, even at low doses, increases your risk. Some medications, including hormone replacement therapy and a mild increase with oral contraceptive pills, have been observed. And we all know that smoking is a big risk factor for not just breast cancer, but all types of cancers. So I believe in many parts of the world, smoking rates are coming down. I don't believe that is also very highly prevalent in India, especially among women, so may not be applicable here. But if you know of anybody who smokes, that's the biggest risk factor for not just cancer, for all forms of disease. So just wanted to highlight that. Now, for the next 10 minutes, what I wanted to was hoping to do is to actually have a very simple approach of describing what are the areas to focus on. There are literally hundreds of topics that have been studied over the last several decades, exploring their association with breast cancer. And I'm only going to highlight, to keep it very simple, the factors that have a strong association with breast cancer. So if you look at all these factors, there are many which has a strong evidence linking with breast cancer. Some of them are very convincing. Some of them are probable. And then you have many factors where there are limited evidence. And you are also classifying that again into, even in the group of limited evidence, some of them are suggestive, some of them are having no conclusion at all. So what I suggest and encourage everybody to focus today over the next couple of minutes is to actually look at those factors where there is a convincing and probable evidence. And we can also include the ones where there is a limited suggestive evidence. Let's ignore all the other factors where the studies have been inconclusive. Okay, this is I think important to mention, because we are always looking to know whether is coffee good, is coffee bad, is something else good or bad. There are so many myths associated with breast cancer prevention that I want to be clear about that. So, and where is the data coming from that I'm going to share now? This is based on the data shared by the World Cancer Research Fund International and the American Institute of Cancer Research. They actually have a citation from the world's largest source of scientific research on cancer prevention and survivorship through diet, weight, and physical activity. And these results were based on more than 100 studies where about 120 lakh women were enrolled, and more than 260,000 cases of breast cancer were studied. Yeah. So now if you look at some of the, getting into the details, you can broadly classify today, for the purposes of this talk, you can broadly classify breast cancer into premenopausal breast cancer and postmenopausal breast cancer. So how do we look at this now? For strong evidence and in convincing manner, there are really no factors which relate to a decreased risk in breast cancer in a premenopausal stage. When it comes to factors that increase risk, and I am actually just mentioning the actual words used in the research articles here, which is called the adult attained height. So this is a proxy for your weight, your BMI. Okay, so there is an increased risk where this is associated with breast cancer in premenopausal case. If you look at probable causes, strong, vigorous physical activity reduces your risk. Okay, high body weight, increased BMI, reduced BMI, reduces your risk. Breastfeeding, so the term used here is lactation. Breastfeeding decreases your risk for premenopausal breast cancer. Among the probable causes, if you take alcohol, increased consumption of alcohol, and greater birth weight increases your risk for breast cancer. Now let's look at the factors for where there is limited evidence in a suggestive manner. These items, consuming non-starchy vegetables, have a decreases your risk for breast cancer in premenopausal women. Again, this is only for one particular subtype of breast cancer, which is estrogen receptor negative. Consuming dairy products reduces your risk. Foods containing carotenoids, and I'll explain some of these later. Diets high in calcium and increased physical activity reduces your risk. This box is empty. There is no factors which is limited suggestive, which increases risk of cancer. Let's look at studies where there are no conclusion. These are many items and topics that you might have heard in terms of, should I have fish, eggs? What about vegetable fat? How about omega-3 fatty acids? How about sugar, coffee, tea, starch, glycemic index? How about vitamin B6? There are all sorts of variables that have been talked about. Does this increase risk? Does this decrease risk? And the conclusion from all the studies is that you cannot have a conclusion whether this is associated with breast cancer or not, either to reduce risk or to increase risk. So my suggestion or my encouragement today would be to actually ignore all of these factors and focus on the earlier ones that we covered. Now, this is the case with premenopausal breast cancer. If you move on to postmenopausal breast cancer, if you take the same approach, you can see that some of these factors repeat. Increased consumption of alcohol, increased body weight, increased adult weight gain. Adult attained height is also a proxy for increased body mass index. Increasing physical activity reduces your risk. The amount of fat when you're young also reduces, is an important factor. If you keep that under control, it reduces your risk for breast cancer in a postmenopausal case. Breastfeeding has an influence in postmenopausal breast cancer as well. The same factors apply here, which are of limited evidence, but you can see that consuming non-starchy vegetables are important in reducing your risk, and foods containing carotenoids and diets high in calcium. All of this decreases your risk. So going to studies where there are no conclusion, a lot of these factors repeat in postmenopausal breast cancer as well. So I would encourage everybody to actually ignore many of these and do not worry about it at this point. Okay. Let's look at, if that is the case, what are the top 3 things we could and should do to reduce your risk of breast cancer? I would summarize it as follows. 1, engage in vigorous physical activity and control your body weight. This is important. Second, reduce alcohol intake. May not be applicable as much as in the Western world compared to what's happening in India, especially among women, but it's still important to mention. And third, consume non-starchy vegetables, dairy products, and foods containing carotenoids and calcium. So these are the top 3 things that I would encourage everybody to, as a take-home message from today's talk on this topic, that you can do to reduce your risk. Let's talk about this in a little bit more detail, because it's important to have a clear understanding of what do you mean by vigorous physical activity. Okay, because a lot of us are not very clear about it. It took me a lot of time to really understand this and actually internalize it and memorize it. Okay, so if you look at moderate intensity physical activity, brisk walking, dancing, gardening, here, doing housework. Of course, here there are other activities that are applicable in the US, but general tasks, carrying moderate loads, they all come under moderate intensity activity. Vigorous intensity activity is actually a more, more involved and actually very intense, as I've listed here. It includes running, walking, cycling, fast, any activity that consumes a lot of energy. So how do we actually have a better idea of what is vigorous intensity activity? So I'll explain that in a moment. But we should also remember, how long should we do it? It should be ideally between 75 minutes to 150 minutes a week. Okay. I would encourage you to actually think about how much vigorous physical activity you all carried out, including myself, in the last 1 week. The chances of that are not very high. And that has to be sustained. You have to do this regularly, right? So what is vigorous exercise? Let's just go through that again. Your breathing should be deep and rapid. You have to be sweating after only a few minutes of activity. You should feel like you can't speak properly because, without pausing for breath. So you have to have that level of vigorous, that intensity when you exercise. And you should aim to achieve about 70 to 85% of your maximum heart rate. That should be the goal. How do you calculate that? You can calculate your maximum heart rate by subtracting your age from 220. So if you're 45 years old, you subtract 45 from 220 to get a maximum heart rate of 175. So that is the level of heart rate that you should have when you do this kind of exercises. So consistently engaging in vigorous physical activity in your life for this duration of time, I would encourage 150 minutes per week, 2.5 hours every week, will dramatically reduce your risk, not just for breast cancer, but for a variety of other illnesses as well. So it's broadly applicable. So this is one of the single biggest acts that we can actually do to decrease risk. Okay, so please keep this in mind. Second, I'll just touch upon this. Strong increase in risk for if you consume alcohol every day. There's a 7% increase in risk on an average for having breast cancer. And let's all keep in mind that water is actually the recommended beverage of choice. Okay, this is according to science. Everything else is to satisfy our other pleasures, but water is the most healthiest beverage of choice. Now let's touch upon what are the recommended foods that reduce the risk of breast cancer. So I indicated non-starchy vegetables and dairy products and foods containing calcium. This is because dietary factors, okay, are very important. Food is medicine, right? If we can actually consume healthy food, it actually has a significant influence on, again, increasing and reducing the risk of not just cancers, but other diseases as well. But with respect to breast cancer, some of the foods that I wanted to just highlight, which is applicable also in the Indian context, are highlighted here. Okay, so broccoli, cabbage, okay, these are all non-starchy vegetables. Cauliflower, peppers, capsicum as we call it, mangoes, tomatoes, very high in carotenoids, also a non-starchy fruit, mushrooms, spinach, they're also very high in calcium. Watermelon, also very high in carotenoids. Sweet potatoes and yams are very healthy, strongly recommended. Pumpkins and carrots. These are some of the examples of food items, fruits and vegetables that have been linked to a reduced risk of breast cancer. But again, many of these should be personalized in terms of if you need more specific, tailored nutritional advice, you should work with a dietitian or a nutritionist or other specialist, like the team in West on Health, for example, can guide you on developing a very personalized regimen on what is applicable to you, a diet, because there could be other disease conditions that are of relevance. Let's say you have diabetes, you may not want to consume a certain type of food. Too many mangoes are not very good in that case, right? So we should be consulting your dietitian and nutritionist to actually optimize your diet. So I would strongly encourage that. And in conclusion, we are around the world, technology is advancing at a very rapid pace, and we are trying to get to a place where you can prescribe preventive medicine. I don't think this is realistic. You cannot buy prevention, but let's all keep in mind that in this case, success is marked by a non-event. When nothing happens, that actually means that we are successful. So with that, I will pass on to Annie.